got some ideas. Recently, he sent the president-elect a petition suggesting what he can do about it, and he joins us now. Mr. Weissman, thanks a lot for coming on. So,
thank you, Tucker. Great to be here.
You've written that the normal critique of healthcare, that there's no price transparency, is not exactly right. Your point is there's really no pricing at all, no legitimate pricing at all, and what many healthcare companies are doing is practicing a species of fraud, as you said. Explain how that works.
Well, that's exactly correct, Tucker. There's actually no pricing in healthcare. As everybody watching the show knows, that when you ask the price of any healthcare procedure, anything from a lab, a physician, or a hospital, you only get one answer. That is, what insurance do you have?
Right.
And your neighbor may be paying 10 times what you're paying or 1/10 of what you're paying, depending on the insurance company and whether or not they have insurance. Now, there's no other business in the United States that I'm aware of that you could get away with that kind of a business practice. I mean, if anybody walked into their grocery store and paid $1 for a can of tuna fish, and then the neighbor walked in and paid $10, they would understand that there was something wrong.
Right.
Healthcare, according to the so-called experts that are industry experts, is extremely complicated. So complicated that ordinary people apparently can't understand it. But in reality, I think they've sold the country a bill of goods, and that healthcare is no different than any other business. What is necessary is that there be legitimate pricing. Healthcare providers should be able to set whatever rate they want, but they've got to set the same place, the same hospital, has to charge everybody the same price. And what that does, Tucker, is a revolution in healthcare and a dramatic reduction in healthcare prices. Because, first of all, networks become completely obsolete. You should be able to go on. You don't need a network to get a fair price. You will be able to Google the price of any procedure in the United States and determine the price. And then health insurance should become like real insurance, like ordinary insurance that we used to.
Right.
Take, for example, homeowners insurance. When your house burns down, any kind of insurance. I'm just using as an example homeowners, but when your house burns down and you're shopping around and you want to find some bricks and some drywall and some paint and cement, nobody says, what insurance do you have? You get the best price you can find and you buy it.
Right.
But right now, consumers in the United States are totally helpless. They can't shop. And the so-called transparency ideas are not going to help.
Wait, but so wait, hold on. Can I stop you there? This wasn't supposed to be this way. I was there when the debate over healthcare happened, and technology was supposed to save us from a lot of this, remember? And Republicans promised that too. It's going to make the system more efficient and more transparent. But that didn't happen.
Well, I'll tell you what's so shocking about technology. Throughout the last several decades, for example, the utilization of hospitals has dropped because of technology. Because now you can go in the morning for a gallbladder operation and you're out in the afternoon. You used to be hospitalized for 5, 6, 7 days. So hospital utilization in the United States, right now, the occupancy rate in hospitals is about 60%. 40% of the beds are empty. In any other industry, you'd see a sale. You should be going on, there ought to be a price line for hospitals. But,
well, exactly.
But price is completely irrelevant. It's not a factor. You get a new medical practitioner, a physician, comes out of medical school, opening a new practice, wants to build a thriving practice. He's not going to go out and say healthcare checkups $19.95 to get some business. He can't do it. If an insurance company finds out he's charging $19.95, they're going to say, hey, we're going to cut your reimbursement rates. Medicare may kick him out because he's charging less than Medicare pays. So
it's just so perverse. Unfortunately, we're out of time. I have about 100 more questions for you. Our viewers, if they're interested in following up, where can they find your petition online and read in more detail about your plan to fix this?
The petition is on change.org, and it's called End Predatory Healthcare Pricing.
Okay, and we're going to put it on our Facebook page right after the show. Stephen Weissman, thanks a lot for coming on. It's really interesting.
Thank you. Thank you for the opportunity. Appreciate it.
Thanks.